Are you looking for a healthcare facility that practices modern medicine the old-fashioned way? GracePointe Healthcare has gone back to how things used to be with their patients paying at the time of their visit. Here to tell us more is Robert Tomsett and Julie Tomsett. Welcome to the show. Great to have you guys.
Thanks.
All right, let's talk about GracePointe Healthcare and how it's different from a typical family practice.
Well, the biggest thing is that we're very, very affordable. Our patients know exactly what they're going to pay at the time of their visit. They pay their bill in full when they leave, and it's over, it's done with, and they don't have any follow-on bills or things that come in the mail later saying, oh, you also owe this or that.
Right, we are all too familiar with that, the dreaded bill that comes a couple weeks later.
Right.
So they know right up front and they pay that day.
Correct. And one of the other big advantages is we've slowed things down quite a bit so that we only see a maximum of 2 patients an hour. So you get a half an hour time, and I really try to set almost an hour for a new patient when they're coming in. So we're back to it's about the patient.
Right.
It's just a wonderful way to practice.
Let's talk more about direct pay. How does it work?
Well, direct pay means that insurance doesn't matter. You pay directly for your care at the time of your care. You pay your bill in full when you walk out, and you're done. And insurance doesn't matter. You can file for insurance. You can take the paperwork we give you and file it on your own, but we don't do it, and that way we've kept our costs way down by doing that.
Right. And you mentioned it was affordable. How much is a typical office visit? What does it run?
For a brand new patient, $89.
Oh, wow.
For an established patient, $69.
Oh my goodness.
And then our lab costs are usually between $5 and $25 for most of the common, routine tests.
Right. We've got some examples of different costs of tests and lab work that can be done, and I was surprised when I saw these at how cheap they are, how affordable.
Right. Well, what's happened is our lab provider doesn't have to bill a patient and doesn't have to send anything to insurance. So by cutting out that middleman, so to speak, and all that paperwork, just by billing us alone, they've managed to cut their costs, and we pass those savings on to patients.
Oh wow. We're seeing some of the costs there on the screen. So the strep test was running at about $10.
Yes.
So this is pretty common to
Yep.
have the affordable prices.
Yep.
Now what if a patient needs an x-ray or an ultrasound, or maybe they need to see a heart specialist? What happens in that case?
Well, we have some preferred providers in the area that will work with our self-pay, direct pay patients. For instance, we have a radiology facility that will do a chest x-ray for our patients. If you pay cash when you go in there up front, $29 for a chest x-ray. That's it.
That's great.
So.
Really helping out a lot of
Right.
people. Now let's talk about your treatment philosophy, and are you open to natural homeopathic medicine?
Yeah, I'm one of those, I don't believe in better living through chemistry guys. If you don't need a pill, you don't need a pill.
Right.
I'm kind of what I tell people a lot of times, the stool of health, 3-legged stool kind of thing. Good nutrition, good exercise, and good sleep. If you can keep those in balance, you won't need to see a guy like me very often.
Exactly.
Unless the colds, flus, and other kinds of things. But those are the most important things. Natural is so much better. However, there are people who that just is too much of a challenge for them, and I'm not against traditional things. If you need an antibiotic, or if you need something for your blood pressure or other, I'm fine. We do the traditional medicine too, but I really try to incorporate natural integrative medicine in practice.
And quickly, what other services do you offer for folks that may not be typical of other family practices?
Well, we do some Botox and filler because I was trained in that also. And then probably our big one is we're a full service travel medicine clinic. I was in the military for 24 years and did a lot of traveling with special operations and things. And so travel medicine is a big part of my life. And I've been on many missions trips. Mm-hmm. So we're fully yellow fever certified by the CDC, and we do a lot of travel medicine for folks too, which is great in this area with all the adoptions and missions trips and stuff. So
absolutely. Well, thank you all so much for joining us. Great to have you today. Hey, you can afford exceptional care at GracePointe Healthcare. They're located in Physicians Plaza of Cool Springs. That's at 740 Cool Springs Boulevard in Suite 110 out in Franklin. For more info, give them a call at 615-599-6868 or log on to GracePointeHealthcare.com. We've got a link to that site on the More at Midday section of WSMV.com.